Welcome to Sad to Carry Online Nursing channel. Nursing is our profession, teaching is my passion. I am Satish Rajamani. In this video, we are going to discuss 30 MCQs which is selected from all ESI nursing competitive exams conducted in various parts of India. Before going to today's question, please subscribe to Sad to Carry Online Nursing channel if you have not yet subscribed. Let's go for the first question of the day. The largest cavity in the human body is option A cranial cavity, B thoracic cavity, C abdominal cavity, and D is pelvic cavity. The right answer is abdominal cavity is the largest cavity in the human body. Question number 2. Which of the following enzymes is found in the saliva? Option A tannin, B ptyalin, C renin, D resin. The enzyme which is present in the saliva is ptyalin. Question number 3. A medical disorder resulting from mutation in a DNA repair system is option A Poly syndrome, B Pyrorobin syndrome, C nephrotic syndrome, D Bloom syndrome. The medical disorder resulting from mutation in a DNA repair system is known as Bloom syndrome. Option D, Bloom syndrome is the correct answer. Question number 4. Find out the odd one. Option A, trachea, B, esophagus, C, bronchi, D, larynx. In this, trachea, bronchi, larynx are related to respiratory system. Esophagus is the odd one, which is GI system. Question number 5. Chemical signals released by an organism that influence the behavior of other individuals of the same species are called. Option A pheromone, option C insulin, option C is androgen, and D is steroid. The right answer is option A pheromone is a chemical substance which is released by particular species of that individual in the atmosphere, which will attract the same species of that particular organism. Question number 6. A condition characterized by moving of bones outside of joint is called option A fracture, B strain, C dislocation, and D is sprain. In this, the right answer is option C dislocation. It is a condition characterized by moving of bones outside of a joint, which commonly defined as dislocation. Question number 7. Short-sightedness can be corrected by using glasses with dash lenses. Option A concave, B convex, C cylindrical, D opaque. Short-sightedness. There will be distance between the lens and the retina is elongated. So the objects fall before the retina. To correct that, we use concave lens. Question number 8. The micturition reflex center is located in the option A pons, B midbrain, C lumbar plexus, D sacral plexus. The micturition reflex center is located in the pons. Pontine center is the correct answer. 9th question. Light year is the unit of option A speed, B time, C mass, D distance. So light year is the unit of the traveling distance. Distance option D is the correct answer. Question number 10. Bowman's gland are found in option A juxtamedullary nephrons, B olfactory nerve, C is external auditory canal, D is cortical nephrons only. The right answer for this, the Bowman's gland is also called as olfactory gland. So it is present in the olfactory nerve. Option B is the Correct answer. Question number 11. Which of the following is the antidote for the toxin benzodiazepine? Benzodiazepine toxicity, the best antidote. Option A, Flumazenil. B, methylene blue. C, deferoxamine. Option D, alkalinized urine. The right answer is option A, flumazenil. Question number 12. Which of the following is the primary site of activity for the drug warfarin? Option A, kidney. B, liver. C, blood. D, heart. Which is the primary site of activity? Note down this highlighted word. And here the right answer is liver. Liver is the site of activity, primary site of activity of the drug warfarin. You can read all the questions and the answers are given in the comment box. Later you can check it. Question number 13. A drug ending in the suffix "navir" is considered as option A, antidepressant. B, protease inhibitor. C, beta antagonist. D, H2 antagonist. If a drug suffix ends with the "navir", that is said to be protease inhibitor. Question number 14. Which of the following drug is associated with the reaction of extreme photosensitivity? Option A, digitalis. B, niacin. C, tetracycline. And D is fluoroquinolones. The drug which is associated with severe photosensitivity in this 4 is tetracycline. Option C is the correct answer. Potassium sparing diuretics have the primary effect upon the dash found in the kidney. The potassium sparing diuretics act mainly upon the distal convoluted tubules. Option D, distal convoluted tubules is the correct answer. Question number 16. A client with gallstones in the gallbladder is scheduled for lithotripsy. For this procedure, the client will be placed in option A, in a prone position, option B, in a supine position, C, in a side lying position, D, in a recumbent position. Dear subscribers, this question we discussed in our WhatsApp group. Many of you have written in a supine position. Option B is the correct answer. But here I like to say that when you give lithotripsy for gallstone which is present in the gallbladder, then you should go for modified prone position. If the gallstone is present in the bile duct, then only we go for supine position. Dear subscribers, please see the comment box. I have given the link below the answer of the question number 16. You click that link and you can you can clarify your doubt. In modern days, in the prone position, when we give for gallbladder stone treatment with the help of lithotripsy, that gives more benefit than the supine position. Along with the image, I have given that. Please go through that. The right answer is option A, in prone position. Question number 17. The nurse is cleaning up a blood spill that occurred during removal of a chest tube. The nurse should clean the blood spill using option A, povidone, B, weak solution of a bleach, C is isopropyl alcohol, D is soap and water. The right answer is by using a weak solution of bleach, the blood stain can be removed. Question number 18. A client with thrombophlebitis is receiving Lovenox, commonly called as enoxaparin. Which method is recommended for administering Lovenox? Option A, Z-track in the dorsogluteal muscle. Option B, intramuscularly in the deltoid muscles. C is subcutaneously in the abdominal muscles, and D is orally after breakfast. Note down that Lovinax is a drug used to prevent deep vein thrombosis. This is mainly used after the hip replacement surgeries. And the right method of administering Lovinax is in the subcutaneous in the abdominal muscle. The common route we prefer is subcutaneous. It is not effective to administer in intramuscular route. Question number 19. A mother of a 2-year-old hospitalized with lead poisoning asks the nurse to explain the treatment for her doctor. The nurse explains the nurse's explanation is based on the knowledge that lead poisoning is treated with option A gastric lavage, B antiemetic, C activated charcoal, and D is chelating agents. Here, lead poisoning, lead is the metal. So to remove the metal from our body, in case of poisoning from our body, we use chelating agent. The chelating agents form a water-soluble complex with the metal, and it helps to prevent the absorption and facilitates the excretion of the poisoning metal from our body. So option D, chelating agent is the right answer. Which of the following is the best indication that a client with ineffective airway clearance need suctioning? Option A, oxygen saturation, B is respiratory rate, C is blood sounds, and D is arterial blood gases. So, in for a client with ineffective airway clearance, the best indicator which tells the suctioning is needed is breath sound. Note down the auscultate the breath sound, and that will indicate that the nurse suctioning is needed or not for that particular patient. 21. The nurse administers cleansing enema. The common position for the procedure is option A, Sims lateral position, B is dorsal recommend position, and C is supine, and D is prone. For cleansing enema, lateral left side Sims lateral position is best indicator. 22. Which of the following is included in the ORM's theory? Option A, maintenance of a sufficient intake of air, B is self-perception, C is long and belonging, D is physiologic needs. The right answer is maintenance of a sufficient intake of air. ORM self-care deficit theory tells that the patient must be having the ability to intake the air by himself, not with the help of any support. 23. 1 teaspoon is equal to option A 15 ml, B 60 ml, C 45 ml, D 30 ml. This question also we have discussed in our WhatsApp group yesterday, and most of you have given the right answer that 1 teaspoon is equal to 15 ml. Question number 24. It is described as collection of people who share at some attributes of their lives. Option A family, B community, C nursing, and D clubs. So when people together sharing common attributes, they are called as community. Question number 25. Which of the following is the abbreviation of these drops? Option A DRB GT, C GTTS, and D is DP. The medical abbreviation for the drops is GTTS. It comes from the Latin word guttae. Option C is the correct answer. Question number 26. Which among the following is not suggestive of acute myocardial infarction? Option A, a sudden onset of severe central chest pain. Option B, a sudden onset burning hypogastric pain. Option C, a new onset complete heart block. Option D, sudden death. Among these four, the option B is not a suggestive of acute myocardial infarction. A sudden onset of burning hypogastric pain is not a suggestion of acute myocardial infarction. Question number 27. Identify the incorrect statement regarding ET suctioning. Option A, pre-oxygenate the client. Option B, follow aseptic technique. C is lubricate catheter before insertion. D is apply negative pressure while inserting the tube. Incorrect statement regarding ET suctioning here. Option D, applying negative pressure while inserting the tube. All other three options are correct statement. Question number 28. The priority nursing diagnosis for the client with tracheostomy is option A, pain related to tracheostomy, B, impaired verbal communication related to tracheostomy procedure, C is ineffective airway clearance related to tracheobronchial secretions, D is risk for impaired skin integrity related to tracheostomy incision. The right diagnosis which is getting the priority in this tracheostomy for a client is option C, ineffective airway clearance related to tracheobronchial secretions. Question number 29. Important points need to keep in mind while doing eye irrigation is option A, use a strict aseptic technique. B, irrigate less infected eyes first, then more infected eyes. Option C is irrigate from inner canthus to outer canthus. D is all the above. The right answer is all the above. Question number 30. Which of the following is a manifestation of pyloric stenosis? Option A, tenesmus, B, steatorrhea, C, regurgitation, and D is projectile vomiting. So in pyloric stenosis, the classical sign and symptom is projectile vomiting, a forceful vomiting. Here we come to the end of today's video. Thanks for watching Sato Career Online Nursing channel. Don't forget to give like for this video and please comment about this video and these questions. Thank you. Bye bye.